Informed consent prior to immunization. Consent for series process. Mature minor in a school setting. Immunization involves complex conversations, including informed consent, health assessments, and other health issues. There is a difference between obtaining informed consent to immunize and deciding to do the actual immunization. The health assessment and eligibility and contraindication determination are aspects of the decision to immunize using clinical judgment. These are all outside the scope of obtaining informed consent. The purpose of this demonstration is to focus on obtaining informed consent from a mature minor in a school setting. The process for obtaining informed consent consists of 7 steps.
Hi, my name is Mary. I'm one of the public health nurses. What's your name?
Mark.
Mark? And did your parents sign a consent for you today?
No, but I'd like to get my shot today.
If a student presents without parent representative consent, it is the immunization provider's professional responsibility to inform him or her about a mature minor's right to provide consent on their own behalf. Proceed with the consent process according to health authority guidelines. In the following scenario, mature minor consent is obtained in the school setting.
Okay, well, in order for you to give consent for yourself, we need to go over a few things. Is that okay?
Sure.
Okay, great.
Throughout the appointment, the vaccine provider assesses the mature minor's capability to give consent, taking into consideration such issues as cognitive functioning, hearing, and language barriers.
Now, Mark, have you seen this health file here?
No.
Okay, well, why don't we go through it together then, all right?
Sure.
Now, in grade 9, we offer this vaccine to protect you against tetanus, diphtheria, and pertussis, or whooping cough. It's 1 shot in your arm, and a booster dose is due every 10 years. By getting immunized, you protect yourself as well as others.
Thank goodness, only 1 shot today.
Vaccine provider goes on to describe the diseases to the student from the health file, and then reviews the possible side effects.
Now, some common reactions to this vaccine include soreness, redness, and swelling where the shot was given. You may also have a fever or a headache. If you get any of these, they usually occur within a day after the vaccine. These side effects are mild and don't usually last long.
Okay.
Okay. Now, have you ever had a life-threatening allergic reaction?
No, not allergic to anything.
No? Did your parents ever mention that you were in the hospital with any serious illness?
I'm pretty sure I've never been in the hospital before.
Okay. Now, sometimes when people have a dog bite, bad cut, step on a rusty nail, they get a tetanus shot. Do you think you may have had a shot for something like this in the last 6 months? Maybe in an emergency room or a medical clinic?
I remember getting a tetanus shot from my doctor. But that was 2 years ago when I fell off my bike.
Okay. Did you have any reactions from that shot?
No, not a thing.
Okay. You can still get this shot then today.
Vaccine provider reviews the following information with the student. Risk of not getting immunized, who should or should not get the vaccine, common and expected side effects, possible serious or severe adverse events and their frequency.
Now, I need to tell you that there's a very, very rare chance, less than 1 in a million, that you'll have a severe allergic reaction immediately following immunization. This could be hives, trouble breathing, swelling of the lips or throat. And we want you to stay in the waiting room 15 minutes after the shot because we can better deal with the situation if it happens. Okay? And if it happens after you leave, we want you to call the local emergency number right away.
Great, I don't have to go right back to class.
Vaccine provider confirms understanding by assessing nonverbal cues, client questions, and clarifying the client's reasons for silence or refusing to engage in discussion. For example,
Okay, now before we go ahead, I need to know that you understand what we talked about.
Okay.
Okay. So what are you going to watch for in the next day after the shot?
A fever, headache, a sore arm. Could I still play basketball tonight?
Yes, absolutely. Now, it's good to move your arm after the shot. If it's sore, you could put on a cool cloth or take some pain medication. It's a lot of information to take in, I know. Do you have any other questions?
No, I'm good.
Okay. Now, what I'd like you to do is fill out this consent form while I get the vaccine ready. Great, looks like you filled everything out. Are you ready to get your vaccination?
Okay, let's get over with.
Document that mature minor informed consent has been given or refused according to the Health Authority guidelines, paper or electronic.